Hyperbaric oxygen therapy, the missing link in cancer treatment. Hello, I am Dr. K. Paul Stoller, and some of you know I have a webinar on alternative cancer treatments, and some of you know I am a hyperbarist. For cancer has a secret advantage. It thrives where oxygen is low. Inside solid tumors, there are regions of profound hypoxia. And in that environment, cancer becomes stronger, more resistant, and harder to kill. Hypoxia doesn't just help tumors survive, it transforms them. It drives treatment resistance, immune suppression, cancer stem cell formation, metastasis. In other words, the less oxygen, the more dangerous the tumor becomes. So what if you could reverse that environment? What if you could flood the tumor with oxygen? That's the premise of hyperbaric oxygen therapy. Delivering pure oxygen under pressure to penetrate deep into tissues, including tumors. Research suggests hyperbaric oxygen doesn't act in just one way, it acts in four. It remodels the tumor microenvironment. Tumors are physically dense, packed with collagen and fibrotic tissue. Hyperbaric oxygen reduces that density, softening the tumor, improving blood flow, and allowing drugs to penetrate deeper. It targets cancer stem cells. These are the most dangerous cells responsible for recurrence and metastasis. By reversing hypoxia, hyperbaric oxygen disrupts their survival pathways, reducing tumor stemness. It reactivates the immune system. Tumors suppress immune attack, especially under low oxygen conditions. Hyperbaric oxygen restores immune activity, enhancing T-cell infiltration. It is the T-cells that destroy the cancer cells, and guess what chemo wipes out? Yep, it wipes out our T-cells, the very cells required to fight cancer. It increases oxidative stress. Selectively, cancer cells are vulnerable to oxidative damage. Hyperbaric oxygen increases reactive oxygen species, pushing cancer cells toward apoptosis. That is where the mitochondria in the cancer cells get healed enough to realize they're in a cancer cell and know what to do, commit suicide. There is nothing like hyperbaric oxygen to rehabilitate mitochondria. We know using hyperbaric oxygen in combination with artemisinin will decrease tumor growth by 35%. This is just one alternative modality. Imagine the synergy between 10 alternative interventions. That is what my cancer protocol is all about. Improving tumor penetration, immune response, and overall treatment effectiveness. Because one of the greatest challenges in oncology is not killing cancer cells. It's reaching them, penetrating the tumor. Overcoming the metabolic derangement, hyperbaric oxygen addresses all this, and more, not by targeting the cancer directly, but by changing the environment it depends on, which includes a sick mitochondria. Now, you might be asking, if this were true, then why isn't it being used? Because there is no profit in the cure. Most of you know that. Cancer does not exist in isolation. It exists in an environment. And sometimes the most powerful way to fight it is not just to attack the tumor, but to change the conditions that allow it to survive. That is why cancer is a metabolic illness. To learn more, enroll in my webinar at KENNETHSTOLLERMD.com. Hope to see you there.